This patient is a 63-year-old female with a long history of right shoulder pain, and she has a rotator cuff tear, which is demonstrated right there by that suture. We're going to create a lateral portal first by needle localization, and then we'll go ahead and introduce a shaver through that portal and start to debride her bursa and around her rotator cuff tear. And we'll address that later. Right now what you're looking at is the acromion, and we're starting to debride the lateral aspect of the acromion. We go ahead and introduce a shaver first, and then now we have a burr here. We're starting to take down her CA ligament, which is part of the impingement arc. And now we're starting to address that bony spur on the front of her acromion with that burr. And we're just continuing to work here. Notice that there's not a lot of blood. The anesthesiologist tries to keep the blood pressure low for us. And again, continuing to work with this helicut burr through the lateral portal, working on this spur. You'll see some fibers of the deltoid appear right in front of that burr. And now what we've done is we switched the arthroscope to the lateral portal, and now we're working through the posterior portal with that burr, sweeping it back and forth, shaving down that bone, and creating a lot of room for the rotator cuff and shoulder to move. Again, taking down that spur, converting a type 3, which is a hooked acromion, to a nice smooth type 1 acromion, which is more smooth surface. We'll just continue to debride that bone and make a nice smooth surface with this burr, sort of touching things up here. And at the end of the video, we'll look down on the rotator cuff, and you'll be able to see the tear that we'll address. You'll be able to see that in another video. So again, just touching things up here, and we'll look down. Right now, you'll see the rotator cuff tear, which we address in another video.